Hi everybody, I am Dr. Aditya Raut. I am a cataract, Lasik and refractive eye consultant at RAUT EYE CARE Pune. Today I am going to help you choose which is the correct lens for you for your cataract surgery based on some scientific facts and what you need from cataract surgery. So to decide what is the right lens, you need to first decide what is your expectation from surgery and what functionality would you need from your eyes specifically after cataract surgery. Now, in my experience, every single patient has different needs and different expectations. So let me break some of them down that I have encountered. Many people don't want to use glasses after cataract surgery, sometimes for distance vision, for near vision, for their phone, or some people don't want to use glasses anywhere at all. The first choice to make is, does wearing glasses after cataract surgery bother you? Is it a factor in which matters to you during your cataract surgery? In case wearing glasses is not a problem, you don't need to think any further. You just go in for something called a monofocal lens. A monofocal lens is a lens that focuses light at one focal point, and this lens can be of different materials like silicon, PMMA, or acrylic. Once this lens has been implanted in your eye, your cataract surgeon will check what your glasses number is after surgery, and wearing those glasses should give you clear vision at all distances. In case you don't want to wear glasses, at least for distance vision, but don't mind wearing glasses for your mobile reading and your near vision, you have to go in for something called a monofocal lens or a toric monofocal lens, which has been specifically calculated based on the measurements of your eye. Just like your spectacle glasses number, even the power of the lens that is being implanted in your eye has to be calculated using some theoretical or hypothetical formulas, and that helps us get your spectacle power number as close to zero as possible after cataract surgery. Toric lenses are lenses that correct the astigmatism in your eye. What that means in very simple terms is that even though everybody's eye looks circular or a round when you look at it, when you actually measure it, almost everyone's eye is slightly oval in shape. Some people's eyes are oval vertically, some people's eyes are oval horizontally, and a toric lens compensates for this kind of oval shape of your eye, helping us bring the number as close to zero as possible, eliminating the need of wearing glasses at least for distance vision while driving or while watching TV. Still, mobile reading or reading fine prints would still need you to wear glasses. Now, using a monofocal lens or a monofocal toric lens gives you the maximum clarity that you can achieve after cataract surgery, because these lenses are trying to focus light only at one point. 100% of light that is being transmitted into your eye will be focused from this lens onto your retina. What that means is better contrast sensitivity while driving, better crisp, clear vision for distance and TV using a monofocal or a monofocal toric lens, which has been specifically calculated for your eye. In case now you don't want to wear glasses for distance as well as your mobile or your laptop, which is your intermediate distance, in that case you would need something called a EDOF lens, which stands for extended depth of focus lens. These lenses help focusing the light for distance as well as your intermediate work. However, these lenses, to provide this effect, this depth of focus, split the light between your distance and intermediate focus, leading to a small drop of contrast sensitivity and clarity. Most patients do not notice this difference, but scientifically speaking, when any lens splits light or focuses it on more than one point, there will always be a slight loss in quality and contrast sensitivity. However, it will help you not needing glasses for intermediate work. In the case that you want complete spectacle independence, no glasses for distance, intermediate or near work, you would have to go in for a lens called a trifocal or a progressive lens, or also sometimes called multifocal lenses. All these lenses fall under a bracket of lenses that split light in one certain way or another to three different focuses, which help you not wear glasses at any distance. However, these lenses are associated with some side effects like halos, glare, a rainbow effect around light, which may cause trouble while driving. The incidence of these side effects can be greatly reduced by correct measurements, correct positioning during surgery, correct alignment of the lens during surgery. However, they cannot be completely eliminated, and out of a large population of implantations of this lens, we will always find certain number of patients who complain about these side effects. Finally, it comes down to your choice of what is more important to you. Is crystal clear, crisp vision more important to you while you don't mind wearing glasses for reading and for your mobile? Or are you ready to compromise a little bit on the clarity and the color contrast to have the independence from glasses in everyday life? This decision must be taken in consultation with your ophthalmologist, and this decision will decide which kind of lens, what type of lens you would require for your cataract surgery. There are many methods of measuring the eye, measuring different angles of the eye, different structures of the eye, to determine whether a multifocal, trifocal or EDOF lens will give you side effects. Once these measurements are done, I generally counsel patients of whether they should even think about putting a trifocal lens, or that this lens is most likely going to give them side effects. If you pass these measurements, if all the measurements of the eye and the scans of the eye show that the likelihood that you would have any side effects are very minimal, then it is a good option for people to consider putting this lens in their eye to get spectacle independence.